Welcome to your favorite show, Pink and Purple. My name is Tempi Pidai and I'm your host. So today on the show, for the first time, we do have a male person and his name is Dr. Untitled Chapter. We will be discussing cancer together with a cancer survivor, Mrs. Anita Jameson. Welcome to the show.
Thank you very much.
Thank you for coming. I almost did say welcome, ladies, because we're so used to having ladies. Mtao, would you like to tell us about yourself and the work that you do?
Yes, as you have rightfully said, I'm a medical doctor, and I'm currently practicing at Mpilo Central Hospital.
All right.
Yes, and I'm also the Secretary General of Zimbabwe Hospital Doctors Association,
All right. Okay.
which is basically an association of doctors who are working in government hospitals.
Okay. All right. Interesting. And Anita?
Hi, I'm Anita. When I left school, I went into sales and marketing. But now recently I've just joined a company, a guest house in Hillside. So I do the marketing and administration for the guest house.
All right. Lovely. So, Doc, would you like to tell us, define also to us what cancer is and the different types that are there?
Okay. So I will try to make it as simple as possible.
Please.
So that everyone
understand.
But I will try to also balance my terms so that even the other people who are in the medical field may also benefit from our conversation.
Yes.
But basically, cancer. Cancer, I would like to start maybe probably by just saying how the body is made. Body is made of cell.
Right.
And these cells, they group together, and what they form what are called tissues. And when this group of cells that are now tissues are organized again into further groups, and these groups, they form what we call organs. And by organs, we're talking about the liver, the kidneys, the heart, and everything that you may think of.
Right.
So basically, a cell is the basic unit of an organism. Okay. So these cells, they always grow. If someone is injured, there's a wound, the cells will grow to replace those that are dead.
Okay.
But when we have cancer now, cancer arises when there's abnormal and rapid division of the cells.
All right.
Okay. So they just keep on dividing and become as many, as numerous as they are. With that, usually there's a natural system that they reach a stage, then they die and they're replaced with other cells. But when a cell or when an organ becomes cancerous, it means the cells are just keeping on dividing and there's nothing stopping them.
Right.
And that's how cancer arises.
Right.
And in terms of what kinds of cancers do we have, usually cancers are just divided into two. We have what we call benign cancers, and we have what we call malignant cancers.
Okay.
Benign cancers, they are the most common ones, fortunately. And the good thing about them, they are easily treated.
All right.
Okay. So what really distinguishes benign cancers from malignant cancers is that benign cancers, when they are dividing, they are usually collected. They are well localized.
Right.
They don't have that propensity to spread to the whole body.
Okay.
Which is different when it comes to malignant cancer. In malignant cancer, cells, they are dividing,
Right.
and they can pass through the blood to other organs, which is called metastasis. And in some instances, they pass through what we call lymphatic vessels.
Okay.
Okay. But basically, the important message is that in malignant, which is the more dangerous and the more that people are afraid of, because it spreads throughout your body,
Right.
and as a result, it will cause malfunctioning of other organs.
Okay.
Yes.
All right. Anita, you're a cancer survivor. Would you like to briefly tell us your story?
Yes, well, I was diagnosed with ovarian cancer in 2010.
Okay.
But I had a problem since like 2002, and they couldn't find the problem. So it started with two miscarriages, and then I had a German cyst, which was figured out in Harare by a Dr. Suddens.
All right.
And then also I was under professor in Harare, and but it wasn't really found at the right diagnosis, like what doctor had said, whether it was benign or malignant.
Okay.
At the time, only in 2010, they had found out that then, in about 2005, there was a cell that was there, a cancer cell, but it was benign, which was just supposed to have given me chemotherapy and it would have treated that cell. But in Cape Town, by the time all this problem, my liver started malfunctioning and there was so many issues with my weight and my menstruation and all that kind of thing, and a lot of pain. By 2010, when we went to Cape Town for a second opinion, the doctors there had found out that it had broke away.
Okay.
So it had spread all over the body.
Right.
And it was now here in my neck, where there was a lump actually protruding out of my neck. So yeah, it like he says, it's cancer, and everybody gets scared about it when they hear about it. But there is stages where it can be cured.
Okay.
But I think it's just a matter of finding out which stage you're at and where it is at, so that doctors can attack it as soon as they can.
All right. Okay. You will tell us more.
Yes.
Viewers, will take a short break. Join us after these messages. Welcome back. You're still watching Pink and Purple, and I'm in studio with Dr. Mthabisi and Anita. Anita, you were telling us your story briefly. Please continue and get into detail.
Thank you.
Yeah.
Thank you again, Tembi. Yes, so like I was speaking about the fact that the cells can run away, can break away from being malignant, being benign and then going into being malignant, and then now the cancer starts spreading. That's unfortunately what happened to me. So I was under so many doctors and so many diagnoses from 2002 right up to 2010, when I was now fully diagnosed with cancer, ovarian cancer, which had spread right up to the neck. And this was found out in Cape Town at Kruger Hospital. So I had to leave Zimbabwe and go there to get treatment. Lucky for me, I have citizenship, so that's how I got to manage to get treatment that side. But it was very, very difficult for me and my family at the time, because I had to leave the doctors here, not knowing what they had did and if they did the right thing or diagnosed right, or whatever the case may be, because now practically I was dying. I had lost a lot of weight and I couldn't eat anything, and I was really literally very, very sick. And I went under serious consultations with the doctors that side. I went through interns, professors, and only to find out that at the end now they had said they were going to give me a year to live. So the professor...
And which year was this?
Sorry.
Which year?
2010.
Okay.
Yes.
All right.
So the professor that I was under, Professor Van Wyk, had just said, look, let's try and just give her excessive chemo, because she was still very, I was still young at the time. And immediately I went on to excessive chemo, which was 72 hours at a time, which I had to have 6 cycles of chemo. But my body could only take 4 cycles, because your body, it's not just the cancer that kills your body. Whilst you're having chemo, it's actually the chemo that actually destroys the good cells. So there's no time for them to actually, get better whilst the other ones are dying. Your whole body is literally dying. But I must say that I had a lot of faith, and I had a lot of people praying for me. And I knew that I couldn't die. I wasn't ready to die. I hadn't yet had kids, and I just wanted, there was so much more I wanted out of life. So I think that it's also your positivity that matters, and your faith, the level of faith that you have. But I still did the chemo, because medically you can't put that aside. You have to go through those procedures. And I went through the chemo. It was horrible. I lost all my hair. I lost more weight. I was very, very sick. The side effects of chemo are really bad. And but I went through it. I did 4 cycles of chemo and went through a lot of tests and scans, and it was a really hard emotional road for me, but I went through it.
Look at you now, 9 years later.
Exactly.
Okay, that's lovely.
Thank you.
Doc, she mentioned that she had to go to Cape Town. And because you had citizenship there, it was a bit easy for you to get medical attention. Imagine if you didn't have.
Exactly.
And also, does that mean we don't have proper health facilities to facilitate cancer patients and for them to go through chemo?
Yes, I think right now, currently, it is more or less common knowledge that we're a developing country, and obviously, when it comes to health facilities, we are under-resourced in terms of even the medical equipment and the medical expertise.
Right.
So when it comes to cases like cancer, like she rightfully mentioned, when you are treating a cancer patient, you need a multidisciplinary approach.
Okay.
Yeah, by multidisciplinary approach, I'm saying you have to bring everyone on board, not just medical doctors. Like she said, that she also had faith. You also need some faith, some counselors on the picture, and even in the medical profession, you don't only need you need different specialists, radiologists, oncologists, and things like that. And these things actually really need resources. In Zimbabwe currently, I'm aware that we only have 2 radiotherapy machines. The other
In the whole country?
The whole country, you can say. The other one is at Mpilo, the other one is at Pararinyata Hospital.
Okay.
But, you know, in most cases, some of this equipment won't be working. Like in the past few weeks, the equipment was not working. So obviously, that's why you see that at the end of the day, most patients might actually opt to go out of the country to seek alternative interventions.
Right. And at what stage does a patient detect that they have cancer, or does the doctor detect that this patient's cancer has gotten to this stage and whatnot? Do we have also adequate doctors who are able to, you said you had a lot of doctors, I mean, looking at your health and stuff like that?
Yes, it depends on the type of cancer.
Okay.
She had ovarian cancer.
All right.
And ovarian cancer is difficult to really pick up, really, because remember, ovaries are just deep inside your body, and most of the symptoms are not as obvious. Like, for example, someone with breast cancer can actually pick up that I now have an unusual mass. You straight away go for medical intervention. But when it comes to ovarian cancer, that's where it becomes a bit tricky now. So yes, it depends on the type of cancer. Some cancers, you can actually pick them as early as possible, and others, it takes time to pick them, to diagnose them. And unfortunately, the more time you keep on or you keep without receiving the appropriate medication, the more advanced the disease gets. Okay. So that's why you see that she actually ended up going to South Africa when the cancer had already spread the whole throughout the body, which is actually not out of the ordinary. It's expected for ovarian cases, because sometimes you actually get symptoms as a result of the metastasis, not basically as a result of the cancer itself. Like I was saying, that when you have malignant cancers, they can spread to your lungs. When cancer goes to your lungs, start coughing up blood, and you have difficulty in breathing. When it goes to your head, you start getting confused and sometimes paralyzed. These are other things that you get as a result of advanced disease, cancer disease. Yes.
All right. And Anita, your life was dependent on a doctor. What is your experience like thinking, if let's say you didn't have faith, you know, and your life was dependent on the doctors, you had so much trust that they were going to help you go through the cancer and everything that you had. What was your experience like in relation to the doctors attending to you?
Well, because I had been through so many doctors, like from Bulawayo to Harare, and then landing up in a foreign country, you know, I didn't even actually want to see any more doctors, because I had been through so much surgery and so much pain and all that. But at the end of it all, you know, you basically just have this one person that's going to make you better and see you through, you know. And for me, I was the professor that I was under was so old, and that gave me a bit more faith that he would know what he was doing, since he was in the field for so long, you know. And when the interns used to come in, I used to get really scared, because they were now just like I was a guinea pig type thing. Because I remember so many times so they would talk to say that this kind of cancer and this kind of patient, you know, it's so prolonged that it has spread. So now this is our chance now too, because I mean, she is just going to die, you know, type thing. So it was very difficult, but at most times I was under great care. I mean, even though Zimbabwe, like you said, is a developing country, at the time when I was under the doctors here, they did all they could. But because, like you said, the ovaries are so deep, there was just, they had diagnosis that maybe it's this, maybe it's that, but it was never ever said it was cancer. So I must say that I felt quite secure with the doctor that I was with, and had faith that he would see me through, which he did with the help of God. Yes.
All right, that's lovely. So before we take a break, take us through chemotherapy. What is it? At what stage does a patient go for chemo? Doc, maybe?
Yeah, chemotherapy is not necessarily the only way that all cancers are being treated. There are some cancer types that respond to chemotherapy, and there are other cancer types that don't respond to chemotherapy. Actually, I think it's also imperative to also maybe probably just give a descriptive overview of how cancer is treated in generally. Like I said, that the cancer types, there are two types, benign and malignant. Benign cancers, they are well localized. They don't spread to other parts of the body. So management is just usually surgical. You just go in, remove the cancer, and that's the end of it. There's no any risk of that it's going. Some cancers can recur, but most of the time they don't recur. Benign cancers. Then when it comes now to malignant cancers, we have a number of modalities that we can use as intervention. Surgery obviously has an important role. What surgery does, it debulks the tumor. Right? You have a mass which is just made up of abnormal cells. So surgery obviously sometimes has a role where you have to just remove that mass. But it doesn't end there. Remember, it's a malignant tumor, so it spreads to other parts of the body. So once you remove that mass of abnormal cells, then you can put other modalities like chemotherapy.
We haven't got into chemo there.
Yes.
Okay. Just a second. May I cut you off there? You will take us through the chemo, right? Fully. We just want to take a short break. Viewers, join us after these messages. I'm here with Dr. Mtabisi and Anita Jameson. Welcome back to the show, and Dr. Mtabisi was still explaining to us the stages of chemo.
Yes. So after removing, through surgery, chemotherapy then comes into play. Basically, chemo, which means chemicals, right, is just using drugs to kill the cancer cells. Remember that you said cancer by definition is just an abnormal division of cells. So chemotherapy, you are using drugs now to kill those abnormal cells. So you can either kill the cells or you can stop them from dividing. And like I said, that chemotherapy is only indicated in certain types of cancers, like hair cancer, which was, you said it's dysgeminoma. Yes. So dysgeminoma is also a type of cancer that is very responsive to chemotherapy. It responds very well. But other cancer types
don't respond.
So there are different types of drugs that you can use for cancer patient. And for dysgeminoma, sometimes they are combination most of the times. And for dysgeminoma, sometimes they use, I don't know in South Africa what did they use, but the standard is what we call a PEB, right? Which we have a drug that is called cisplatin, also a drug that is called bleomycin, and the E for etoposide.
All right.
So those are the drugs that they actually they actually put them inside what called through the IV. Yes. Through the IV. So this is now systemic treatment because the body was all over, the cancer was now all over the body. So the medications now will be killing all those abnormal cells in the body. And remember, these are body cells, but they're now abnormal. But when you're now giving patients chemotherapy, sometimes those drugs may actually start killing what? Normal cells.
All right.
For example, the cells that produce hair follicles, they are also fast dividing cells. They divide very fast. So those drugs and chemotherapy may also target those fast dividing cells, because they cannot tell whether this fast division is it normal or abnormal. So that's why you see that she ended up losing hair and stuff like that.
All right.
Yes.
A quick question. There's a misconception about cancer that it's witchcraft. You know, in our African culture, when somebody has cancer, we've always thought it cannot be cured. And a lot of people don't seek medical attention. They'll probably go to somewhere else to get a cure. Yes, to get cured. So what's your comment on that?
Yes. Cancer is a medical condition, eh?
Okay.
And as a medical professional, I advise people that they should, by all means, avoid alternative interventions besides going to an established medical facility.
All right.
Because once you have cancer, it means it has to be treated as early as possible. And this is quite unfortunately in our setting, that most people still believe that traditional medicine is a role in treatment of cancer. And this is the reason why most of our patients that present, they've advanced diseases.
All right.
And some studies have actually postulated that in Zimbabwe, very few people can live up to 5 years once they're diagnosed of cancer. And the reasons are straightforward. One of the major reasons is that people, they get the symptoms, they are aware that they're no longer feeling well.
Okay, but
and they still have that belief that if they go to a certain nyanga,
they will.
Because the conception or the understanding from them is that it's a result of witchcraft.
Okay.
So they start seeking assistance from traditional healers.
All right.
You see?
Okay.
And by the time when they come back to the hospital, and by the time they notice that the interventions were not helpful at all, it's now advanced disease, right? And they don't even have the money to pay for the medical tests that are now required. And this is the main reason why most of the times we lose our patients.
All right, okay.
But that's the important role now that we must have as citizens to increase awareness about cancer generally.
Okay, all right, because cancer is a medical condition. As we round up, what do you have to say? Just 3 words maybe, or just a sentence to any other cancer patient who's out there, because you're a cancer survivor, as we round up the show.
Yeah. No, I'd just like to encourage anybody, male, female, young, old, whatever you are, whatever you stand for, whatever. Cancer is for everybody. It's not just targeted for certain people or certain ages.
Right.
And it can be cured.
Okay.
It can be cured no matter what. I'm living proof of that. It's 9 years this year that I do not call myself remission. I call myself healed.
Yes.
So I know that with the faith that you have and seeking medical attention, no matter where you have to go, if you value your life, you can be healed of cancer, and it can be treated. And just don't give up. Just have faith that you can be healed.
Okay.
Yeah.
All right. Thank you so
much,
Doc and Anita, for coming onto the show. It's been lovely.
Thank you for having us. Thank you.
All right. Viewers, thank you so much for watching Pink and Purple. From me, Tembi Pira, and the crew behind the scenes, it's goodbye.
SO2EP8 tine tariro burai chanaya tijke tigute SO2EP8 tine tariro zuari chabuda tionera mangwana zuari no buda tionera mangwana guvande amari guvande believe with hope. Ay, 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 ay. Ay, 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 ay. Oh, yeah, 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 yeah.